Hi, so my name is Roger Flores. I'm the chairman of the Department of Thoracic Surgery here at Mount Sinai School of Medicine.
My name is David Yankelevitz. I'm a professor of radiology at the Mount Sinai School of Medicine.
So lung cancer is a type of cancer that develops in the lung. Frequently, people will not understand what that means because sometimes they hear about in the news like someone had a pancreas cancer or a colon cancer that went to the lung. And then they think, oh, does that mean that the person had lung cancer? No. When they biopsy that lung and they look at it under the microscope, they'll see pancreas cells if it came from the pancreas. They will see colon cells if it came from the colon. And if it came from the skin, they'll see skin cells in that biopsy sample. What lung cancer is a cancer that originates in the tissue of the lung, and it destroys the normal lung in that area. So when you biopsy the lung in someone who has lung cancer and you look at it under the microscope, you see lung cells. So it is a cancer that originates in that lung tissue. And that tends to be very aggressive. Many lung cancers can spread very quickly to the lymph nodes, to the brain, to the bone. And that's why lung cancer is very important to catch it early when it is curable.
The symptoms of lung cancer is a very important question, and it's one of the reasons why screening is so important. Lung cancer in general doesn't produce symptoms early on. The lungs can actually have a cancer in it that's growing that doesn't cause any symptoms until it's late. And when it's late, the symptoms are commonly things like coughing up blood, chronic cough, hoarseness of the voice. Sometimes people feel a little discomfort in the chest or chest pain, or it might even be from symptoms because the cancer spread to other parts of the body already. You can present with a seizure, for example, if it spread to the brain. The most important thing about the symptoms, again, is that lung cancer typically presents with symptoms very late in the course of the illness. And I again stress that's why it's so important for people that are at high risk that they should be screened. The second part of that question, sorry, what was the risk factors for screening? The main risk factor for lung cancer is smoking. And the more the smoking, the higher the risk. The older the patient, the higher the risk. By far, that's the most important risk factor. There are other risk factors, in particular, family history. If you've had brothers, mother, father, even more distant relatives with history of lung cancer, that increases your risk. And the more family members that have had it, your risk is even higher. Other risk factors include if you've been exposed to radiation, if you work in a place that has a lot of radiation around, atomic energy workers, for example, or if you have radon in the house, people check for radon in their homes, and that's another risk factor. Sometimes toxic gases that people have inhaled through work, and there's a variety of them that can cause it. Asbestos exposure can cause increased risk of lung cancer. So I think those are the main risk factors.
One more thing to point out, when David was talking about a seizure from lung cancer, what's important to know is when you biopsy that tumor, that lung cancer that gave you a seizure, it's not a brain cancer. When you look at it under the microscope, you see lung tissue there. So I think that's an important point that people understand. When lung cancer goes somewhere else, it's the lung tissue that has gone to that area, as opposed to a new cancer developing in the brain. So I think Dr. Yankelevitz really pointed out all the important things. It's not just smoking. It is asbestos, it's radon, it's secondhand smoke. There are other things that have not been technically proven that cause lung cancer, other chemical exposures, marijuana, things like that, that there's controversy with, but that there's not enough scientific evidence to show for sure. I think that you also have to realize there's a certain number of patients, between 15–20%, who have never smoked or have never had exposure to anything to cause lung cancer, and they can have lung cancer. So just the presence of two lungs is enough to get lung cancer. But there are certain risk factors that put you at a higher level, and it's those patients that should be screened.
I'll add to that a little bit. There are guidelines now that are currently in existence for who should be screened. These come from either Medicare or other insurance companies, and they've just recently been updated. The current guidelines were that people should start getting screened at the age of 55, and they've had to have smoked at least 30 pack years. And pack years is the following. If you smoke 1 pack a day for 30 years, that's 30 pack years. If you smoke 2 packs a day for 15 years, that's also 30 pack years. So you can calculate it that way. The most recent guidelines have modified this a little bit and made it a little bit easier to get the screening. So now they've lowered the age to 50, and they've also lowered it to 20 pack years for who should be screened. Those are the recommendations, but I think, and I'm sure Dr. Flores would agree, that there are still other risk factors. And if you're at high risk, you've had family members, even if you don't meet those criteria, you should really talk to your doctor about getting screened. People that have been exposed to secondhand smoke, and I'm really happy that Dr. Flores brought that up, that's a very high risk group as well. They really need to, again, talk to their physicians about whether or not they should consider being screened. Whether you're younger or even if you smoke less than the recommended amount. We think it's very important to weigh all of your options and really consider what might work best for yourself.
So that's a very important point, because many people think that screening is a one-shot deal, and it is absolutely not. It's a process. So when you initially screen somebody, the best way to think about it is you find a lot of noise, and you got to make sure that the doctor or the surgeon that you see doesn't have a quick trigger finger. You don't want somebody that right away is going to jump in there and start taking things out. Screening is a process. So whatever you see in that initial scan, most of the time, that's a lot of noise, slow growing things, little non-specific nodules. It's the CAT scan that you get every year that shows a change is where you find the cancers that are trying to grow and to kill that patient. So it is the yearly scans, that process of a yearly CAT scan for high-risk individuals, that saves lives. So when you see something new or a change in that scan, that's when you got to really jump on it and either take things out with surgery or biopsy them to see what they are. That will really make a difference in people. That one CAT scan, that, like I said, is a baseline. It's the yearly CAT scans that are the things that save lives. So screening is a process. It's not just a one-time CAT scan.
First, I'll just say, when you think about CAT scans, we used to have to explain what a CAT scan was to people. Nowadays, I think CAT scan is very well known to people. Many people have had CAT scans for a variety of reasons, whether it's related to their lungs or their abdomen. But just as a starting point, I'd like to say that I like to think of CAT scans as a form of X-ray. And when you think of the difference between a plain X-ray and a CAT scan, it's a little bit like looking at a loaf of bread. When you look at a loaf of bread, think of that as the plain X-ray. And when you think of slicing the bread and looking at each individual slice, that's what a CAT scan does. And as CAT scans improve and get better over time, you can think of looking at thinner and thinner slices. But you're looking at all the slices that make up that entire loaf of bread. The thinner the slices get, the smaller the things you can see, which translates into finding lung cancers earlier and earlier, or smaller and smaller. The reason you need annual scans is that you can have no findings on a scan today, but in a year from now or 3 years from now, you might then have the earliest sign of a cancer. So that's the reason that you want to keep doing the scans year to year, because you want to find the cancer if the person is going to have it when it's at its smallest size, because size is probably the most important indicator of whether or not something is going to be cured. So the smaller the size, the more curable, and the more you do the screening, if you do it annually, the more likely you'll catch it when it's at its smallest size and therefore at its most curable stage, which is the most important thing. The other thing is that the annual screen, when you do it once, it's sort of the first time, but potentially if you're 50 years old, you're going to be at risk till you're 80 years old. So that's 30 scans altogether. So the one scan in the beginning is really not the most important. It's the scans each year thereafter that you stay in the process that allows you to catch the cancers over your lifetime of being at risk. So that's why it's so important to stay in the screening process.
Yeah, so lung cancer is curable. You don't hear a lot about that. It's curable with surgery. The problem is that we don't catch it early enough. The problem is when we see lung cancer, it's when it already has spread, when people are coughing up blood, when they're having seizures, when they have bone pain. But if you catch a lung cancer at its early stage, the vast majority are curable. So yes, there is a cure for lung cancer. It's called surgery. We just have to catch it at an early enough stage. There are a lot of promising medications, targeted therapy, immunotherapy that have helped and have shown responses, but the only real thing that has proven to cure patients is surgery. People have to understand is lung cancer, when caught early, is not just curable, but it's curable with minimally invasive surgery. So in the old days, you didn't have CAT scan, you had an x-ray. And when you have an x-ray, the only way you would find the cancer is when it was the size of a golf ball. Not a golf ball, a softball. Now with CAT scan, you are catching things when they're the size of a penny. So the surgery is actually less surgery. When you find something that small, we make 3 little small holes in your chest and you take it out with a small piece of lung. As it gets bigger, sometimes you need a segment of lung removed, something called a lobectomy. And we can do that with 3 small holes in your chest as well. When you catch it later, when it's involving a bigger part of the lung, then you need to have your entire lung removed. And so you want to catch it while it's small and while you can do it with the little small holes as opposed to making a big incision in your chest. Now, if it's caught at a later stage where you need the whole lung removed, you still can have a great life. The Pope is missing a lung and he bounces around the whole planet like nothing's happened to him. So you want to minimize that though. You don't want to put yourself in a position where you need to lose your whole lung or where you're not even a candidate for surgery because you can't be cured because it's too late. So the earlier you catch these cancers, the more likely it's cured, the more likely you can preserve lung. I've had some patients with early lung cancer who've run marathons afterwards. And the more likely you can have the surgery with the 3 little tiny holes as opposed to a big incision like that.
It's a little bit of a two-parter. The first part of the answer is that if you're a smoker, you should quit. That would be by far the most important thing you can do. The other things which are potentially useful if people around you are smoking, you should avoid the secondhand smoke. If you're in an environment that has known causes of lung cancer, high radon background or asbestos, you need to get away from that. That's the most important thing in terms of what people describe as primary prevention. Secondary prevention is if you're going to be a person that gets lung cancer, then you want to get it when it's early. And you want to get involved in screening. People often refer to that as secondary prevention, but really what it means is that if you're going to get lung cancer, catch it early, because when it's found early, it's highly curable, and that's your best chance.
So I think the main thing that you want when you're concerned about having lung cancer is you want to make sure you go to a team that covers every base. So when you look at our program here, Dr. Yankelevitz and I and Dr. Henschke, we are in constant communication. We will look at scans together. We will say, should we watch this? Should we biopsy this? Should we take this out? You want to make sure that you have a team that works closely together. You don't want to get a scan somewhere else, have it read by somebody else, have it biopsied by somebody else, and have it taken out by another surgeon at four ends of New York City. You want to make sure that the surgeon does not have a quick trigger finger. You want to make sure that they don't just jump in there for any finding. And that's where the team approach comes into play. So let's say I look at something and I'm concerned about it. And I say, maybe this should go to surgery. Then when I go over it with David, he may say, you know, Raj, that doesn't concern me. I think that's just some inflammation. Don't operate. Let's get another scan in a few months and see what happens to it. Then you get another scan, you see that the thing disappeared. So you want to make sure that you have an entire team and that you're not just relying on a surgeon or on a radiologist or on a pulmonologist. You want an entire team there. And I think that's the best approach when you're looking at lung cancer screening. You want an entire team that can give their input, a team of experts.
And I'll add the following thoughts to that. I think when you think about lung cancer really is perhaps one of the most fatal of all the cancers there are. It's not the type of cancer, if you had to get a cancer, that you would want to get. The only thing that's potentially good about lung cancer is that if you catch it early, or what makes it good for screening, I should say, is if you catch it early, it's highly curable. So in a sense, it makes it the ideal cancer to be screening for because it's highly curable when you find it early. And sadly, it presents without symptoms or presents with symptoms only when it's late, when it's highly incurable. So it's very important to do the screening. When both Dr. Flores and I started at Mount Sinai about 10 years ago, there really wasn't much of a screening program. And at that time, the large majority of cancers seen in Mount Sinai were late-stage cancers. As we've introduced the screening program and as it's grown, that's changed. We now have the majority of the cancers we see at Mount Sinai are early stage, highly curable. So it's a tremendous change in what we've seen. And it's really what we dream of seeing is even more and more, higher and higher percentages of the early stage cancers. And that's why our screening program is so important to us. And we advocate very strongly that people speak to their physicians, contact us at Mount Sinai. We have 7 hospitals in our healthcare system. There are screening programs at all the Mount Sinai systems, and we're really encouraging people to call and find out about the screening and get involved.